Is obesity a personal failing or a symptom of a larger societal problem? Don't forget to subscribe for more information on food supply. This question has haunted public health experts, policymakers, and individuals struggling with weight for decades. Conspiracy theories abound, whispering of government plots and corporate manipulation. While these theories often lack evidence, they highlight a crucial truth. The obesity epidemic is far more complex than simple willpower. The truth is, obesity is a multifaceted issue deeply intertwined with socioeconomic factors, access to healthcare, and the very fabric of our food system. Unraveling this complex web requires us to look beyond individual choices and confront the systemic forces shaping our health. The statistics paint a stark picture, revealing a troubling trend that demands our attention. In the United States, over 42% of adults are classified as obese, a number that continues to grow each year. This figure has been steadily rising for decades, reflecting changes in lifestyle, diet, and physical activity levels. This epidemic is not confined to the US. It's a global concern with serious implications for public health. Countries around the world are grappling with similar challenges. Obesity increases the risk of chronic diseases such as heart disease, stroke, type 2 diabetes, and certain types of cancer. These health issues can lead to severe complications and even premature death. These conditions not only impact individual lives, but also place a significant strain on healthcare systems worldwide. Hospitals and clinics are overwhelmed with patients suffering from obesity-related illnesses. The cost of treating obesity-related illnesses is staggering, reaching billions of dollars annually. This financial burden affects not just healthcare providers, but also taxpayers and insurance systems. Clearly, addressing this issue is not just a matter of personal responsibility. It's a public health imperative. Communities, governments, and organizations must work together to create effective strategies for prevention and treatment. To understand the obesity crisis, we need to examine the environment in which it thrives. One of the most significant contributing factors is the prevalence of processed food. Cheap, readily available, and often marketed directly to children, these foods are laden with sugar, unhealthy fats, and empty calories. For low-income families struggling to put food on the table, these processed options often become the default, not due to a lack of desire for healthy food, but due to sheer economic necessity. The reality is, nutritious food is often more expensive and less accessible in marginalized communities. This creates a system where unhealthy choices are practically subsidized, perpetuating a cycle of poor health. Enter Universal Basic Income, UBI, a radical policy proposal gaining traction worldwide. This concept is not just a fleeting idea, but a serious consideration in many countries. UBI advocates for providing all citizens with a regular, unconditional sum of money, regardless of their employment status. This means a steady income for everyone, from the unemployed to the working class. Proponents argue that UBI could alleviate poverty, reduce income inequality, and provide a safety net for those struggling to make ends meet. It could transform lives by offering financial stability and reducing the stress associated with economic uncertainty. But could UBI also be a tool in the fight against obesity? The answer is complicated. While financial stability can lead to better health choices, the relationship between money and health is multifaceted. On one hand, UBI could provide individuals and families with the financial breathing room to make healthier food choices. With more disposable income, people might opt for nutritious options over cheaper, unhealthy alternatives. With the pressure of food insecurity alleviated, people might feel empowered to invest in fresh produce, lean proteins, and whole grains. This shift could lead to a significant improvement in dietary habits and overall health. Additionally, UBI could free up time and resources for individuals to engage in healthier habits. Without the constant worry of financial strain, people might find it easier to incorporate regular exercise into their routines. With less stress related to finances, people might find themselves with more time and energy to cook at home, exercise regularly, and prioritize their well-being. This holistic approach to health could be a game changer in the fight against obesity, making UBI a potential ally in promoting a healthier society. The double-edged sword, potential pitfalls of UBI. However, it's crucial to acknowledge the potential downsides of UBI in relation to obesity. Critics argue that without proper guidance and support, the additional income could be misspent on unhealthy foods and behaviors. There's a risk that individuals might prioritize convenience over nutrition, opting for fast food and sugary drinks even with more financial flexibility. Moreover, UBI alone cannot address the systemic issues that perpetuate unhealthy food environments. If processed food remains cheaper and more accessible than fresh, nutritious options, the root causes of the obesity crisis will persist. Beyond dollars and diets, a holistic approach. In this section, we delve into the broader perspective of addressing societal issues through a comprehensive lens. Therefore, it's essential to view UBI not as a magic bullet, but as one potential piece of a much larger puzzle. This puzzle includes various interconnected elements that work together to create a healthier and more equitable society. To effectively combat obesity, we need a multi-pronged approach that addresses both individual and societal factors. This includes not only economic measures, but also health, education, and community initiatives. Investing in nutritional education. Empowering individuals to make informed food choices through comprehensive nutrition education programs is crucial. These programs should be accessible to all age groups and tailored to meet the needs of diverse communities. Promoting access to affordable, healthy food. Expanding access to fresh produce in low-income communities through initiatives like community gardens, farmers markets, and healthy food subsidies can make a tangible difference. These efforts help bridge the gap between economic constraints and healthy living. Regulating the marketing of unhealthy food. Limiting the marketing of processed food and sugary drinks to children, particularly in vulnerable communities, is essential. This includes stricter regulations on advertising and promoting healthier alternatives. By combining these strategies with the potential economic empowerment offered by UBI, we can create a more equitable and health-conscious society. This holistic approach ensures that we address the root causes of health disparities and work towards a sustainable future for all. The power of policy, shaping a healthier future. Policymakers have a crucial role to play in shaping a healthier future. Implementing policies that support healthy food environments, regulate the marketing of unhealthy products, and ensure access to affordable healthcare are essential steps. Furthermore, investing in research to better understand the complex interplay of socioeconomic factors, food environments, and individual behaviors is vital for developing effective interventions. The obesity epidemic is a complex issue that demands a comprehensive and collaborative response from policymakers, healthcare providers, communities, and individuals alike. Breaking the cycle. Individual empowerment. While systemic change is crucial, individual empowerment is equally important. Taking ownership of our health starts with making conscious choices about the food we consume, the amount of physical activity we engage in, and the ways we manage stress. Small changes can make a significant difference over time. Cooking meals at home more often, incorporating more fruits and vegetables into our diets, and finding enjoyable ways to move our bodies are all steps in the right direction. A call to action. Your health, your voice. The obesity crisis is a complex issue with no easy solutions. However, by fostering open dialogue, challenging misconceptions, and advocating for evidence-based policies, we can create a healthier and more equitable future for all. Your voice matters. Engage in conversations about food justice, support policies that promote healthy food environments, and hold elected officials accountable for prioritizing public health. Stay informed, stay engaged. This is not the end of the conversation. Stay tuned for more insights, analysis, and actionable steps we can take together to create a healthier world. Remember, knowledge is power. The more we understand about the forces shaping our health, the better equipped we are to make informed decisions for ourselves, our families, and our communities. Don't forget to subscribe for more information on food supply.